Oh, thank you. I'm really glad to share our experience of subliminal laser in chronic central serous chorioretinopathy with you. So I have to figure out how to. Yes. Briefly, central serous chorioretinopathy is a disease of posterior pole with serious detachment of neuroretina. And it affects mainly middle-aged males and among other many risk factors, stress, corticosteroid use, and certain genetic susceptibility is very important. And CSC presents itself mostly with thickened so-called pachychoroidal vessels, and over these thickened pachy vessels, you see mostly a hyperpermeability and also mostly in combination with RPE dysfunction. So classically, we divide and we differ CSC in two forms: acute CSC with focal hotspot, minimal RPE changes, and this subtype tends to spontaneous resolution in around 80%. And if no resolution is observed in acute CSC, current literature recommends us a therapy within 4 and 6 months. Whereas chronic CSC is with diffuse leakage and mostly with extensive RPE changes. And here it leads to a progressive loss of photoreceptors, as you can see here, and therefore therapy is recommended. So I want to give you briefly again the literature for current therapeutic options for chronic CSC. And as you know, mineralocorticosteroid receptor antagonists, oral medication as eplerenone and spironolactone, half-dose photodynamic therapy, and subthreshold microsecond laser therapy, so-called SubLiminal therapy or micropulse therapy. So beginning from the eplerenone or spironolactone, it's very promising, yet the data is a bit limited. And if you decide to treat your patients with these oral medications, you have to monitor them very carefully through the general practitioner because it can cause possible systemic side effects, and you have to check the potassium level. Half-dose photodynamic therapy is a very effective therapy in central serous chorioretinopathy. However, there are some contraindications, as you know, and if repeated, especially more than 2 times, it can cause possible choroidal ischemia or RPE atrophy. And subthreshold laser therapy modalities are a safe alternative to half-dose PDT, and they can be repeated as needed. Anti-VEGF is only recommended for secondary CNV in central serous chorioretinopathy, and laser photocoagulation is practically, the conventional laser is practically obsolete in our clinic. So another word, before treatment of CSC, it's very important to check out risk factors, is intake of steroids, pregnancy, Cushing syndrome, new medication, and also I really recommend to perform an OCTA to exclude the secondary CNV additional to the conventional angiography. As you can see here in this example, it's really not so suspicious for a CNV and fluorescein angiography also, but in the OCTA we can detect a CNV membrane. So going back to the subliminal therapy. In CSC, it's important to treat the areas of choroidal hyperpermeability, and it should be guided by FA or ICGA. And it's very important to perform a dense multi-spot treatment, because only this way we can ensure a homogeneous application of the spots. And laser settings, as you heard before, again, 160 micrometer spot size is quite large. It's a fixed duty cycle in our clinic, at least 5%, and we use also foci area centralis. And as you can see, it's this area that, what we treat. And we have also mentioned before, but it's very important to do a power titration. So it's individually, the NRG is chosen individually, and for that, a single spot in subliminal mode in 5% DC should be applied in the periphery, and you increase the power level until a barely visible threshold burn is observed here. And then you reduce the energy by 50%, and you can evaluate this in a healthy macular area, not in the pathological area. And after this evaluation, we recommend you to perform the dense multi-spot subliminal treatment on these hyperfluorescent areas. And also, we don't recommend a transfoveal treatment, although it's described in the literature, and we would keep 500 micrometer distance from the foveal center. So, how are our experiences? We do perform regularly subliminal laser and also half-dose PDT in our clinic for the CSC patients. And here I want to present our data from the University of Cologne from treatment-naive patients, which we have treated, 48 half-dose PDT patients and 41 subliminal patients, with a median observation time in both groups around 20 weeks. And the patient percentage who have received 2 treatments are quite similar in both groups. And if we look at the completely dry rate, we see after PDT 62% and after subliminal 68%, which is significantly not different. And how they develop over the time, after the first PDT, the percentage of the patients who are completely dry are indeed a bit more, but after 2 consecutive therapies or 1 or 2 consecutive therapies, we see really no difference, and it's a safe treatment. So you would ask me, why it was not so in the PLACE trial? PLACE trial was the prospective trial who has compared, which was comparing 800 nanometer micropulse laser with the PDT for chronic CSC. And if you look at the data of the PLACE trial, we see the completely dry rate after the PDT was 67%. In our clinic, it was 63%, so it's very comparable. But we look at the micropulse laser and we see 28%. Why this discrepancy? So, in my opinion, different settings. The settings of the laser should be optimized. And it is possible that different lasers may cause different effects. However, it's not the only explanation, for sure not. It is a multi-spot, it was not multi-spot delivery, so if you don't do multi-spot, it is possible that inhomogeneous effect can be caused. In PLACE, another difference, I mean, it's different settings, there was no titration. We recommend you individual titration of the energy. But in my opinion, the most possible explanation for this discrepancy is not the use of the OCT angiography in the baseline, because it is very possible that in patients with subclinical CNV were included in the trial, and therefore maybe the results were so different from each other. Going back to the subliminal therapy, we recommend monitoring 6 to 8 weeks after the treatment. And here you can see also the effect in the fluorescein angiography as well in the ICGA. And at last, I want to show you some cases. Here, male persisting suprarenal fluids since 5 months, after 1 subliminal therapy, 8 weeks after, completely dry. The second case, persisting fluid since 11 months. After the first laser, we see reduced fluid. So in these cases, we recommend a retreatment. And after the retreatment, 6 weeks after the second therapy, we see a completely dry finding. So another case from our clinic, a 60-year-old female decided as first-line half-dose PDT. After the first half-dose PDT, we see reduced subretinal fluid. After the second one, persisting fluid. So what to do? We are performing a subliminal therapy for the non-responders after PDT, and we find a completely dry finding. So in summary, subliminal laser is a safe treatment alternative for chronic CSC, but secondary CNV and also other diseases should be excluded before treatment. And we recommend to apply subliminal laser in a dense multi-spot after individual titration, and also a monitoring after subliminal 6 to 8 weeks. And if persistent fluid, please consider a treatment. Thank you.